Hey, welcome to Your Personal Health. I'm Jeff Harrison, along with the infamous or the famous Dr. Krista Burris. How are you today, Dr. Burris?
I'm doing great. How are you?
Good. Hey, I love. We just came from. If you haven't seen that yet, go back over and check it out. It's COVID-19 update. It's week 900. No. It's week about. It feels like it. I know, right? It's got to be. We've got to be really close to like what 55 weeks or something like that.
Yeah, I think so. I think definitely in the 50s now.
Jeez, 50 something. We're 50 somethings. But that was an update with a lot of good news in there, but also something, you said that all of a sudden it kind of, as somebody working behind the scenes, like my ears perked up and said, oh, wait a minute. Yeah, I didn't think of it that way. Would you take just a second and talk about the fact, hey, the numbers are really good. We're like 3.0 or 3.1 here in the Coachella Valley, but you take over.
But we've kind of stalled and we're not really making progress over the past week and a half. And so that means that we're really close to qualifying to move to the orange tier, but we're stuck. And so I think we need to be a little cautious and maybe not get too excited and ahead of ourselves, lightening up or loosening up some of our public health protocols so that we can continue our improvement in our numbers that we've been seeing up until this past week.
Another thing on that is, and I didn't realize this because shame on me, because my wife and I don't have children. I was speaking to somebody yesterday and they said, oh, the kids have gone back to school. So there's some triggering events going on out there. The restaurants are opening back up. We're able to eat inside a little bit. We're going back to school with the kids. They're a little bit more activity. I've noticed seems like there's more traffic out on the roads. There's certainly more people. Like I went down El Paseo the other day and it's like, holy smokes. I'm like, you wouldn't know there had been a pandemic. Are those triggering events almost like spring break or Christmas or those type of things, Dr. Burris?
Oh yeah, absolutely. The last time we were sort of in this range was right before Thanksgiving. And we had moved into October and we were feeling pretty good. And people were kind of upset that Halloween wasn't happening like normal. And then our numbers started to creep back up and we hit the holidays. And those two holidays on top of each other really spurred this huge surge that we had. And now we're moving back into that same pattern where we were going down and everyone's feeling pretty good and we're opening back up and we're having more gatherings. And, honestly, Easter's right around the corner, Passover, and then we're going to be heading back to Memorial Day, which if you remember last summer is what drove our summer surge. So my hope is that we don't repeat that pattern, that we actually vaccinate fast enough and can just be self-disciplined enough to make it a few more months with, slowly opening up some of our community activities, some of our businesses, getting the kids back to school, maybe having some sports events, but without completely going nuts and having crowded restaurants and bars with no masks and people having huge house parties. If we can just hang in there and skirt another surge, we may be looking at a pretty good summer.
Well, you said something again that I didn't want to overshadow, because let's face it, this show is about your personal health and there's nothing more important than making sure you're getting vaccinated. You had mentioned during the 3:00 show of the COVID-19 update that we're starting to see unused appointments for getting vaccination. Would you mind just kind of, not to rehash it, but really to take it, to explain those people that are joining us on this program, maybe they missed the COVID-19 update, why that's happening and what kind of effect that might have?
So I think what's happening is that we've hit a point where we're starting to have the people who really wanted the vaccine have gotten it. And so now there's this large group of people who are eligible for the vaccine, but who may be less excited to get it and maybe be putting it off a bit. And so they're not really like stalking the websites waiting for
Mm.
that vaccine appointment to open up. If you remember when they first started vaccinating, those appointment slots were gone in less than an hour. And now we're having, by, almost every day, vaccine appointment slots go unused. So it's not that we're done vaccinating the people who are eligible. We've actually gotten to the point where maybe we need to start helping those around us access vaccine, or encourage people who might be a little reticent, direct them to websites or videos that, explain the vaccines if they have questions, that kind of thing.
Do you think it's probably true with almost, using the word vaccination in general? I know there are some people out there that are anti-vaccination versus vaccination. I mean, this is one of those things. Can we compare it to back in the day of polio? Like, hey, you need to get it, because we were talking off camera about knowing people that had COVID before they got the vaccine, and they're dealing with some lingering after effects, like, foggy vision, memory, fatigue, I think you said executive fatigue, that kind of thing. So take us through that just a little bit, and then I want to get into today's topic.
So somewhere in the ballpark of about 20% of people who've had COVID, even mild or asymptomatic COVID, will develop more chronic symptoms. And that means symptoms 3 months out. And it can be anything from, fatigue that's continuing to shortness of breath. And probably the most common complaint is difficulty thinking clearly, having a bit of a brain fog, executive function problems, which means problem solving. And then there's also a large swath of people who are having problems with regulating things like their heart rate. And so who are having like really fast heart rates that make them dizzy or make them faint. So there's all these things that viruses in general can trigger in the immune system. That's sort of like a chronic inflammatory condition. And it looks like COVID is also doing this, but maybe a little more than other viruses in the past.
Hey, the message here, if you're listening, and I think Dr. Burris did a phenomenal job of this, of if you haven't had your vaccine and you're not sure, go get some education, go onto the website, talk to people who've had the shot, understand the value of that. And if you are someone who has had the shot, kind of be a little bit of that, the soldier out there of asking people, hey, have you had the shot? Do you know there are potentially some extra shots available? Please go get your shot, because that will get us over the finish line sooner. It's now is certainly not the time to let our guard down, even though we're around 3% infection rate. It's not the time to say, hey, it's okay, because there are some new strains coming out. There are some new strains that are arriving here in the US, and we want to make sure that everyone is protected. And the best way to do that is to get that vaccine. So Dr. Burris, thank you. You have a comment on that?
I do. One thing a lot of people may not know is that if you have any history of heart problems, you actually qualify as a pre-existing condition right now. And this includes arrhythmias, like if you've had to go and get a stress test because you had chest pain, any of those things really qualify you, because the virus actually does affect the heart muscle tissue. So you would be considered high risk. So some people think, oh, I don't have diabetes, or I don't have Down syndrome, I don't qualify, or I haven't had cancer. But the reality is it's a pretty wide swath of our population who technically does qualify. So diabetes, heart disease, any immune system dysfunction, those are all things that would qualify you, including severe pulmonary disease.
That's great information. Hey, by the way, here in the Coachella Valley, I know the Indio Fairgrounds is set up to give vaccinations, but aren't there many like Walgreens and that type of thing? Are they set up to do those type of things?
Yeah, absolutely. The county has several large sites at the Indio Fairgrounds and the Palm Springs Convention Center, but there are also, dozens of other places in the valley, including the hospitals, the healthcare systems, Desert AIDS Project, Walgreens, CVS, Costco. Many of the pharmacies are giving it. So it's no longer quite as hard to find. And if you're looking for a shot, definitely give us a holler. We can direct you to some resources to help make sure that you get connected with an appointment.
Great, that's good news. Early on when the vaccines came out and they had to be minus X number of degrees and storage was an issue. The question was as well, are you able, because they were saying, hey, call your primary care physician, which was really 99% the wrong question because you're not set up for that, right? Are you in that situation? Do you see that coming soon where as a patient of yours, I can call and say, hey, I haven't had my shot yet. Can you take care of me?
If our patients call us, we're going to actually really help you get that vaccine appointment if you need help. We are not currently carrying the vaccine. And part of the reason is because we do have a smaller patient load. And so being able to contract with the county to get enough vaccine in is complicated. However, we definitely will help people get an appointment if they're not getting one currently. Also, it is still something that we're considering, but it is currently problematic. However, most primary care doctors who have vaccine are contacting their patients to schedule them directly. And so if you are out there and you're wondering if your doctor is carrying it, you can, just call and find out if your office is going to be offering it. But honestly, many doctors' offices have already gotten it and given it to their high-risk patients.
I want to talk today about something that thank goodness I don't have to go through, and that's how do I find a primary care physician? And I want to bring this up from this standpoint. We here in the Coachella Valley, and I can't speak for the rest of the United States, but here in the Coachella Valley, we typically have a high influx of people who come and visit the Coachella Valley for 1 to 6 months at a time. And we're also getting a tremendously high number of people relocating to the Coachella Valley because of the large city process and high rise. And they're trying to get out of a situation where, they're not, if it were to break loose again, they're not stuck in their high rise. With that, there's going to be even more pressure on the healthcare system here in the Coachella Valley. I want you to take us through, hey, how would we go about getting a primary care physician, and tell us how we could get set up with Coachella Valley Direct Primary Care, because it's not the normal of what we probably were raised on. So if you could take us down that road, I'd really appreciate it.
Well, almost every day I see somebody on Facebook or some other social media source asking, hey, I'm new to the Valley. Does anybody know a good doctor that takes X insurance? So often what people do when they come into the new area, or including the Valley, is they start to ask around their social networks, their friends, people they know online, and ask for recommendations. And usually it's with the intention of utilizing their insurance. So it can be a bit frustrating because insurances will change from year to year and add doctors or drop doctors. So someone may recommend a doctor to you, and then you call the office and they don't take your insurance. Or you call your insurance and you think a doctor's covered, but then 2 months later, they're dropped off the plan. And that is extremely frustrating. But I think for most people, they prefer to get some kind of personal recommendation when looking for a doctor, because honestly, it's really hard to tell off a website or something like Yahoo or Yelp, what a doctor's actual experience is going to be like. Often what happens is people who do online reviews are either really, really happy or really, really angry. And we know that there's this vast majority of people that don't leave reviews. And so you're kind of stuck, saying, well, trying to read between the lines, basically, of saying, well, what is this place really like? Or what is this person style like? What kind of doctor are they? So because of that, I think that personal recommendation of asking people who know you, is this a doctor that you think I would, gel well with, is probably where most people feel comfortable getting recommendations, at least to start. And then the second question is always, do you take my insurance? And one of the things that's interesting about our practice is that we don't take insurance. We actually have a direct relationship with our patients where they pay a monthly fee and we provide them primary health care. So they still have insurance that they utilize for things outside of our office. But when they're in our office or needing primary care services, that's all been taken care of by their monthly membership, and they don't have to worry about how much is this going to cost if I need this. If you need something that we provide, then we provide it because you've already paid for it. And that allows people to really plan a little better for what their healthcare expenses are going to be, because there aren't as many surprises outside of an emergency or some kind of extreme problem. Their regular primary care needs are being met.
Well, I have a question on that. As someone who may be hearing this for the first time said, "Hey, that all sounds well and good, but it sounds like it's only going to cost more to change the way I do things." And I'm going to take myself back as a kid when I know that when something catastrophic happened, that's when we use insurance. It's almost like insurance on my car. Like if I have to replace tires, I mean, I know Dr. Kim's not here because he's working on changing a tire or something on the car. He didn't call State Farm and said, "Hey, State Farm, hey, Jake from State Farm, I need a new tire." It just doesn't work that way. But it seems like nowadays the insurance is a point where, like, no matter what, we brace ourselves on that insurance. I'm just wondering, with the way you're describing Coachella Valley Direct Primary Care, is if someone comes to you, and this is a loaded question because I already know the answer because I am a patient of yours, is if they come to you, could we anticipate saying, "Hey, I know I'm paying a fixed price every month, everything else is taken care of," and then really set my insurance up as my catastrophic plan? And when you do that, it probably is not going to cost you any more money. In fact, it might even save you money. Or am I being too optimistic?
Actually, I think that works out for a lot of people when they're trying to compare plans and they're trying to get a insurance plan that covers everything that they might need. They end up paying a lot of money for it.
Mhm.
And with our program, people are paying a low monthly fee that's stable for their primary care, and then they can get a more tailored catastrophic plan that's less expensive for those unexpected, like larger expenses. A lot like with your car, you might be willing to, you know, have a higher deductible, get a plan that is a little cheaper on your car insurance, but you're still going to spend what you need to change your oil and, you know, get your brake pads replaced. And that kind of like everyday maintenance is sort of what we do in the realm of primary care. We keep you healthy, and hopefully you don't have to use that catastrophic insurance.
What I love about your program, you and Dr. Kim's program, is the fact that if I come in or I call you and I've paid my monthly membership fee, which by the way is only $149 a month if you're 46 and older. Yes, I'm over 46, and if you're below that, it's only $99 a month. And I know you do things for families or multiple members to help pricing. But when I call you, I know that that call is not going to be like if I call my attorney, no offense to attorneys, that all of a sudden I'm going to get another bill for X, Y, and Z, or there's a $35 copay. It's just, that's it, isn't it?
Yeah. Yeah. And I mean, the idea of it is, yeah, you've joined the practice and we're just taking care of you. And, you know, we're not worrying about billing you or watching the clock to see how many minutes that we need to bill. You know, it's like, frankly, it's a lot easier for us not to do that. So
Yeah.
I, you know, I think this is the type of practice that makes it so much easier for the patient and the doctor because they're not having to think about that part of it. It's taken care of and it's sort of off your worry list.
You know, so here's the thing. If you're going to get a referral, a lot of times and this is an interesting fact, 92% of the people make a decision on where they're going to eat based on a referral. And if the referral rates are high, they go there. You mentioned earlier that to go to a referral site like a Yelp or whatever, probably not the best place to go for doctors because they, let's face it, we forget about it and we're taking care of other things. We don't get to see the doctor because we're going to have a good meal. It's because we probably weren't feeling well. And the last thing on our mind is, hey, let's go ahead and leave a review. Is there a platform out there that's a professional platform that at least says, hey, at least I know this doctor is operating on high integrity. There's no problems with them. They're not being investigated. Are there platforms like that for doctors?
Yes, actually, the place that I recommend if people really want to check up on a doctor for some serious, are you worried about a serious problem, is the state board of medicine. So the California Medical Board, if you Google it and then it allows you to look up your doctor, you can do that and you'll see if there's any sort of dings against them. So serious investigations, complaints, censures, that type of thing. And actually, I recommend doing that, especially if you're completely new to an area and you just want to make sure you don't end up, in a really scary situation. I think also often what happens is that you'll see, you know, certain specialties tend to get sued more. That you may find if you're just Googling a physician. But if somebody's been sued like 80 times, that's unusual, you know?
Yeah.
So, um, most doctors will make it through their career with maybe one or two lawsuits, hopefully none. But we live in a fairly litigious society. Surgeons maybe a handful, but you really shouldn't see a red flag would be, over 10.
Mm.
Um, so anything from the state censuring the doctor or a record of just high numbers of lawsuits would probably be a red flag for me. Um, as a doctor, I don't take a bad review on a Yelp, for instance, too much to heart on another doctor's website because there are always going to be people who will give a negative review, whether it's a restaurant or a doctor or store. If there's only negative reviews,
Mhm.
I think that would give me pause. But the other thing is doctors are notoriously bad about managing their online um, personas. you know, in fact, most doctors don't even have functioning websites. you know,
Uh,
so this is an area where the medical field in general is not that good. um,
that's an interesting stat because about the doctors not managing websites. I'm not offended or bothered by that because quite frankly, I would rather you be focused on what you do your best, and that's being a doctor and caring for my health. Even if it's just a portal of like click here and call this number, better than just because it's fancy. And we at Swing Point Media have over the years done many doctors' websites. And you're right, when we first got in here, you're going, wow, this is kind of archaic. But now when you say that, it makes so much sense because it's not top of the list. And before I let you go today, though, because we're just about to the top hour, it always goes so quickly. I want to talk about probably the most important thing, and that's access. Can you give us an example of access to Coachella Valley primary care versus a typical primary care doctor? And it's not a slam on anyone. It's just, hey, this is kind of what we see in the marketplace and why you might want to choose to say, if I'm at a fork in a road, do I want to get a primary care doctor that I'm using insurance, or do I want to get a primary care doctor like Coachella Valley primary care and then modify my major insurance so I can have access? So if you could kind of explain access to us just a little bit.
So there are two important features of access. One is being able to contact the doctor and get an answer over the phone. And the other one is being able to see a doctor in a timely manner for your condition. So in a typical practice, it's pretty common for doctors' turnaround times to be about, I would say 1 to 2 days. Sometimes you'll be lucky and you'll get the office staff actually answer the phone. But again, you probably won't be connected directly to the doctor. You may get to speak to a nurse or just leave a message, and then you wait for someone to call you back. And here at Coachella Valley Direct Primary Care, we recognize that this is actually a moment where we can save people time and frustration and often prevent a condition from being handled inappropriately or getting worse. So when you contact us by text or phone, either we'll answer the phone or we'll respond to you, usually within 15 minutes if it's during business hours, and after hours and on the weekend usually it's within the hour. We often will actually answer the phone ourselves, or even Erica, our MA, may answer the phone and get a hold of us, ask us a question, and we usually are responding within a minute or two. So we try to handle people's concerns and what they need and get a turnaround on it, definitely same day and sometimes faster. Secondly, access when you need to get into the doctor. If you've got a really bad sore throat and you're worried about it being strep, seeing the doctor in 2 weeks is not really going to be helpful because you'll probably be better by then. So, being able to get a patient in like that the same day, even on the weekend if we need to, is something that we'll do because we don't have 2,000 patients. We're actually able to do this. We're able to get people in. And sometimes, if we need to stay slightly later to take care of something, it's actually not a problem because we're not so overwhelmed by just sheer volume like you are in a traditional practice.
Mm.
So we are able to offer some flexibility for our patients in the evenings and weekends, as well as get them in when they have an acute issue right away.
Dr. Burris, as always, thank you. Thank you so much. I think you make the decision very, very clear on what path they should take. On the screen now, you see the information for Coachella Valley Direct Primary Care. You can call directly. I'd love to hear the phone call go happen right now because we are live, 760-642-5549, and just get set up. My wife and I have now been with Coachella Valley Direct Primary Care for quite some time. We love it. We're blessed that we're both very healthy, but with this whole COVID thing, have we had to have some tests along the way because of a concern of being exposed to somebody? Absolutely. And it's been like exactly what she explained. Come now. We call and we come now and we get response. It's not like come next week. And the other thing you can do is you can go to their website, CoachellaValleyDPC.com, and find out more information. But the process is so easy. In my past life, I was a golf professional. I would say this is a no-brainer. It's like a 1-foot putt or a 6-inch putt. It's a gimme. It takes no brain cells to say this makes sense. Please go to CoachellaValleyDPC.com, or just call Dr. Burris or Dr. Kim at 760-642-5549. And Dr. Burris, as always, I want to thank you for all you do. And really, if this is the first time you've seen this, make sure to tune in on Wednesdays and at 3:00 and find out what's going on in the Coachella Valley as far as the coronavirus, how it's affecting, what openings we have, the vaccine updates, things like that. Dr. Burris and Dr. Kim take the extra time on their own time and update us to let us know what's going on in the Valley to keep us healthy, because at the end of the day, they're here for your personal health. Dr. Burris, I want to thank you so much for being here. You guys stay safe, and tell Dr. Kim we'll see him next week.
Thank you, Jeff. I really appreciate it.
You bet. Bye-bye.
Bye-bye.